Hi, I'm Lindsay Flanagan, and I'm going to be demonstrating on how to insert an arterial line. There's many uses for this catheter in the critical care setting. It's used for blood pressure monitoring. It's more accurate than a blood pressure cuff. You get a beat-by-beat measurement of the blood pressure, which also helps to indicate the patient's response to treatment or how quickly they're deteriorating. The patient also may be requiring frequent ABG draws due to a certain metabolic process that's occurring, or they're in respiratory distress. This patient also could have this catheter inserted into their radial, brachial, axillary, femoral, or dorsalis pedis artery. The most distal on the extremity is what we should start with, though. Information that the APN needs to know before inserting this catheter would be if your patient's on any anticoagulants or any platelets, because you may be puncturing them multiple times, and you're going to need to know how to control bleeding as well if that's the case. So hemostasis can best be achieved by elevating the extremity or holding pressure. You need to know that the patient might also move during this procedure because radial stick is kind of painful. So you need to caution if they're going to move. You also need to know that the nerves run laterally among or on arteries. So it's important to palpate the artery before you insert it so that you can limit the damage done to the nerves. Supplies that you're going to need for this procedure would be sterile gloves, sterile gauze or towels, sterile drape, chlorhexidine or betadine, the appropriate catheter size for the artery, sutures, adhesive tape, an arm board, pressure tubing, a 500 ml to a 1 liter saline bag, a pressure bag for that, a 1% lidocaine and a 5 ml syringe, a bedside ultrasound, and a transducer for leveling. Education needs to be provided to the patient and the family in regards to this procedure so that they are able to give informed consent, which will need to be gotten before the procedure. You need to tell them the risk for the bleeding and the hematoma. Risks for infection, because this catheter will be removed immediately if not clinically indicated, just to prevent infection. And they should probably try to keep the arm elevated or limit the mobility so that we can get the best readings possible. The assessment criteria that needs to be met before inserting an arterial line would be the Allen's test to test for collateral circulation of the your radial arteries in your forearm or wherever you're going to insert it. You need to know the adequacy of the ulnar artery in perfusing the hand during the manipulation of the radial artery so that you can prevent ischemia of the hand. Monitoring for this procedure would include being attached, or make sure your patient's attached to a cardiac monitor, because you want to be able to know their heart rate and also their blood pressure. They should have a blood pressure cuff on another extremity in case these pressors are going to need to be titrated during the procedure, because it could take a minute to get this in. You also need to make sure that the pressure cable is attached to the line, the pressure tubing, and the monitor so that the APN can see the waveform once they get this catheter in the right position. For this procedure, after you've gotten consent, you explain the procedure to the patient and the family, you perform hand hygiene, you will then perform the Allen test. So if you're going to insert it in the radial artery, you would be compressing both the radial and the ulnar arteries. You can also make the patient, if they're able to, make a fist. You're going to wait till the hand turns a pale color, maybe even cold, because you're blocking blood supply to the hand, and then you will release the ulnar artery and make sure that the hand is going to be perfused. It will turn pink and become warmer, and if this happens, then it should be fine to use that radial artery for the procedure, but if not, you should probably choose another location for the arterial catheter. The RN needs to make sure that he or she sets up the pressure bag and the tubing. The patient needs to be supine for the procedure, and their hand and their arm needs to be supinated. And you can tape their arms loosely to the table, and then use an arm board as well, possibly. Then you'll start to sterilize the arm with betadine or chlorhexidine. You're going to let it dry, and you're going to put the sterile drape over the area you're going to be working with. You need to open all of your equipment and drop it sterilely into the field. And then after that, you can go ahead and don all your PPE, your sterile gloves, and your goggles or our face shield. Now you're going to palpate for the radial artery first. You can also use the bedside ultrasound to visualize that artery. Once you feel like you can feel that pulse well, you can go ahead and insert your 1% lidocaine just to help with some of that pain that they're going to be feeling. Then you're going to hold the introducer in your dominant hand like it's a pencil at a 35-degree angle. You can insert the needle below that area of palpation and wait for the flash of blood. You can use the ultrasound to advance the needle in the artery, and after that flash of blood, use your non-dominant hand to advance the wire and secure the catheter. You will slowly advance the catheter over the wire or needle into the vessel and hold pressure above the insertion site when you go to remove the wire and needle to keep your catheter in place. You will attach the pressure tubing immediately and review the monitor for the waveform. After the appropriate waveform is noted, you can begin to suture that line in and then cover the insertion site with a clear adhesive dressing. You would dispose of your sharps in the sharps container and then document your procedure. You need to make sure that you document how many attempts it took and what complications you ran into along the way. After the procedure is complete, the nurse should level the line, zero the line to atmospheric pressure, and flush the arterial line to show an accurate waveform. And you will see a systolic upstroke, a dicrotic notch at the top, and then a diastolic runoff. So thank you for watching.